Hello there, it's Ryan Liberty. In this video, I'm going to discuss what is Narcissistic Personality Disorder. Alright, here we are, and I'm going to discuss what is Narcissistic Personality Disorder, but before I get to that, I do have a little disclaimer kind of thing I want to say here, so I have it written down below. You'll see me referencing notes throughout this video. The first thing is that this is just a description of Narcissistic Personality Disorder. This is not diagnostic criteria, so it's not meant to diagnose anybody, whether that be yourself or someone else. A professional should be able to give you a diagnosis if that's something that you're seeking. These are only labels that I'm using here, so Narcissistic Personality Disorder as a label. If that bothers you in any way, if it doesn't feel comfortable to use that label, chuck the label away. You don't need to use it. We're really just using it to point towards a set of symptoms or behaviors or whatever that's going on in the life of you or someone that you love. A personality disorder is not something that is set in stone. Personalities can change. Researchers are always getting more insight into what causes people to have different personalities and how to reconfigure those personalities to make a more healthy functioning individual. So just because you see these things, don't think it's all over. Personality disorders are changeable. And there is a lot of stigma around personality disorders about them being bad people or evil people. That's just not true. There's no need to use any of those words. Personality disorder people are just people who have a specific set of rules for dealing with the world that help them to get by. It's the way that they cope. It doesn't mean that they're evil. It doesn't mean that they have bad intent. However, I do have to say a lot of people will come to videos about people with personality disorders who are in bad situations, bad relationships, abusive potentially. And if you find that that's the case, I would urge you to take strategies to distance yourself from that person and exit the relationship if possible, to care for your own self and care for your own mental health. Now, again, that doesn't mean that just because somebody has this personality disorder that's what's going on. I just want to put that little extra thing in there for people who are in bad situations, just because I want to encourage you to take care of your own health. So all of that said, let's get into what Narcissistic Personality Disorder is. I have a whole large number of things here to go over. So I'm just going to kind of go down the list. Now, somebody with Narcissistic Personality Disorder may have an inflated sense of their own self-importance. They may think it's always about them. They focus on fantasies of ideals, success, power, love, and beauty. So they're always the best. They're always the most attractive. They have the most money, the most successful in their field or their business. They're always the most powerful, and everyone looks up to them in their mind. They believe that they are special and should only associate with other people who are special, other elite people. So you'll find that they try to congregate around people that they feel are elite or special, like a club or a specific group of friends. And these people may not necessarily have any kind of status. It's just that in the person with Narcissistic Personality Disorder's mind, they do, and they want to be connected to them, so they stay around them. They require excessive admiration. They always need to be looked at, admired, to have a pleasing eye towards them. They exploit people. That is one of the parts of Narcissistic Personality Disorder. They manipulate people for their own gain. They have a compromised empathy. Specifically, they have difficulty with emotional empathy, but they do have cognitive empathy. They are envious of others, or they believe that people are envious of them. So there's a lot of stuff going on around envy. They either want what other people have, and they try to take it from them, or dismiss it, or deny that they want it, or they're always encouraging people to believe that everybody looks up to me, everybody wants what I have, they're just jealous of me, that kind of a thing. They have arrogant behaviors and attitudes, and this may manifest outwardly in the more stereotypical view of what we think of when we think of somebody with Narcissistic Personality Disorder. So they may yell and scream, they may demand and stuff, but they also may do this very modestly and quietly, and they may just only in their head think that they are, the greatest and the best, and that they should have different treatment than other people. That most of that can also stay in their heads. So either way, they reference other people for their sense of identity and self-esteem regulation. So the way that they know themselves is through other people, and they're always looking for other people to confirm who they are and that they are the best and they are the most wonderful. And they also use other people's praise of them and compliments to regulate their self-esteem. And if anything happens where they feel slighted or injured by somebody else, then their self-esteem kind of goes down. And there's this constant dance of self-esteem when it comes to narcissistic personality disorder, because it does rely on other people's input more than the typical person would. Their goal setting. So when they set a goal, it's based on getting approval from others. They're not so aware of their own motivations. They may not even realize that they're setting a goal to try to get your admiration and to get attention. But typically that's what it really revolves around. They have an impaired ability to recognize the needs and feelings of others. They just have trouble understanding the way you feel. They may rationally understand it, but when it comes to feeling it in their own body, because they have that impaired ability for empathy, they may not feel it themselves. But they are attuned to the reactions of others, and that's where the cognitive empathy comes in, and they can understand why you would react the way that you do to them. Because they're trying very often, again, a lot of the goal here is to keep up a false self and to bolster this image of being the best and being the greatest. So they're aware of how you react to things, and they do try to kind of manipulate to get you to tell them that they're the best and tell them that they are the most wonderful person and all of that kind of stuff. They have superficial relationships serving only to regulate their self-esteem. They have very little interest in other people's experiences, again, because it's all about confirming themselves. They have a condescension towards others, and this kind of goes along with that envy of nobody can be better than I am, nobody can be greater. So they may not outwardly say, I think I'm better than you, or you're not as good as I am, and you're lowly. They may not come out and call you trash, in other words, but they may think it in their heads, and it may show up in their actions and behaviors. They attempt to draw attention away from others and towards themselves. And as I mentioned throughout here, all of these things can be what's known as covert. So they may appear very charming outwardly. They may appear like nice, altruistic, wonderful, modest, kind people. But when you get into their psychology and you get into their mind and you find out why they're doing the things they're doing and the motivations behind them, that's where you may start to see the narcissistic personality. They are often misdiagnosed as depressed because of the way that narcissistic personality feels for them, and we're going to get to that in just a second. But before I do want to say that narcissism as a whole is a normal and a healthy trait that we all have, and that's just that feeling of being able to get up out of the bed in the morning and say, I can do this, or having a project and you're like, I'm going to get this project done, I can do this. That's normal narcissism, and that's healthy. It's totally expected. I guess the point of why I'm saying this is I don't want anybody to hear all of this and think like, oh my God, I'm a narcissist, or somebody else is a narcissist. That everybody has a narcissistic trait. It's totally normal, and it's on a spectrum. So that if you see it in yourself, that doesn't necessarily mean that you're a narcissist. It doesn't mean that anybody else has narcissistic personality disorder. It's just something we all have. Now, there is treatment for narcissistic personality disorder. You can try something called schema therapy, transference focus psychotherapy, mentalization-based therapy, and depending on if you're trying to modify a certain behavior, cognitive behavioral therapy. For the depressive symptoms, you may find that a medication helps, but there is treatment, and it's something that can be worked on. So if you find a good therapist who's worked with narcissists before, then that would be a good starting point to come up with a plan. Now let's get what it feels like for a narcissist. So as far as I could find, there's no like physical symptoms that go on. They don't really feel like anxiety symptoms or anything like that. Maybe just like a little bit of an alexithymia, a bit of a dulling of the sensation, a dulling of emotions, but a dulling of the body sensations. But that's about it as far as what happens in the body. As far as thoughts, a lot of the thoughts are centered around devaluing people who challenge them, and thoughts about themselves and how wonderful they are. They have envious thoughts, as we discussed before, and they may think things such as, no one can do this as well as I can, that person over there is an idiot, how dare she not recognize my importance, everybody is looking at me in this room because they're jealous of me. Those kinds of thoughts are constantly going on. And they may also find that they are confused about the way that other people are acting. They may not understand why some people are reacting to things the way they are, because they're thinking of themselves as the best, and they're thinking that they're doing wonderful, and when somebody challenges that doesn't make sense to them. Now, emotionally, what's going on for somebody with narcissistic personality disorder is they will have those depressed moods when they're having a low self-esteem moment. They feel shame and humiliation when they're challenged, or they're not recognized as the way that they should be. Very often it's a short-lived thing, but it does happen. And there can be a background sense of shame that they may not be so aware of, but it may be there. Anger and rage when they feel like they're slighted. They may feel elation and joy when they're given a lot of attention. They may feel like really high self-confidence as a result of that. And again, as mentioned, they may feel a little bit of an alexithymia and have a dulling of the emotions altogether. It may not feel real, and often that's because they're operating with that false self. And behaviorally, they're going to be always seeking attention in one form or another. It may not look like it's attention seeking, but there's typically going to be manipulating other people to try to get attention. There's this need to prove how special they are, even if it's just telling you how special they are or showing you things that they do. They manipulate other people to get flattery, to regulate their self-esteem. Sometimes that includes putting other people down and devaluing them to show how much better they are. They say insensitive things at very inappropriate times. So, for instance, if you're sick, they may start talking about how healthy they are and how they just got on this new juice cleanse and they feel great, because they don't have that empathy to understand what you feeling sick is like in comparison to them talking about how great they feel. If they may compare themselves to others, and remind others and themselves that they are the best. And if you are somebody who has narcissistic personality disorder, or if you know somebody with this disorder, I just want to emphasize that it is something that can be treated. It's not something to be afraid of here. It's just a personality disorder, but this has been a long video and I want to hear what you have to say about this. So if you feel like I've missed anything or if I'm misinterpreting anything, I'd love to hear what you have to say. Leave that below. And I thank you for taking interest in narcissistic personality disorder and hearing what I have to say today. I hope that it has presented a much more human perspective on this disorder. Thanks for joining me. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.